I'm Roumen Milev. I'm a professor of psychiatry and psychology, head of Department of Psychiatry at Queen's University, and head of psychiatry at the affiliated teaching hospitals. In terms of the clinical services roadmap, I'm the clinical lead for the mental health and addiction group within the clinical services roadmap. Mental health affects roughly 20 to 25% of the population at one or another stage, and addiction is probably a similar percentage. The issues with mental health are very important due to the fact that they carry a lot of stigma. Mental illness have been long regarded as a shameful thing to have and a sign of weakness, and we still suffer from a lot of that view throughout the population. There's no such thing as an average patient. I mean, there's so many different varieties of mental disorders and addictions, and so many different individual situations. The important thing here is that that when you need help, you find it. A fundamental difference in our work is the fact that we no longer look at the individual services, individual providers. The main differentiating point is that we look at the service as a system. And when you look at all the services belonging to a system, then the problem becomes how we design a system in which the person will find the appropriate services and there will be no gaps in between the services where the person just falls through the cracks, so to speak. So what we're doing in our work, we bring all the individual providers, or majority of the individual providers of services together, and ask them to think about the person in the middle, the person suffering from a mental illness or from behavioral problems or addictions, and put them in the center of their work rather than design services around the providers. And I think that although this has been attempted in the past, now we have a much more stronger impetus with the backing up from the LHIN, and also with the possibilities of redesigning the system in such a way that it will realign resources at the right places and the right where the needs are. When a patient attends an emerge at 2 o'clock in the morning and who says, I'm suicidal, there's very little resources you can use apart from admit to the inpatient unit. If the same patient presented the day before at 10 o'clock in the morning or 2 o'clock in the afternoon, there are many more resources you can use to actually help this person overcome the crisis, receive the treatment, being hooked and linked back with their providers and so on. So in that respect, it becomes paramountly important to think of the mental health and addiction services as a system. So the key point here is how do you change, how do you reframe the point of view of all these providers? And the only way to do that is when you put back the person who receives the services in the center. What is best for the person? If you were the person, how would you have liked to see the system working? If this was your brother or your mother, ending up in emerge, how would you like to hear that there's no beds and she will have to stay for 2 days in emerge, and at the same time you learn that the neighboring hospital has 10 vacant beds? So in that respect, back to an example of a patient who ends up in emerge at 2 o'clock in the morning, who ends up being admitted and takes a bed for 2 or 3 days, which otherwise could have been avoided, actually has taken the bed for somebody else who really needed to be admitted, who now will have to wait 2 or 3 days in the emerge room because of that bed being blocked. Well, it is very important to take into account what the opinion of the people for whom the services exist is, because this is what will really guide us to assure that we build a service, a system of services which is responding to the needs of the population. the needs of the population exist of the needs of every individual one at a time. So unless we hear what people are expecting to see from a well-working system, we may have to be wrong a few more times again. So if we have some information and feedback about our initiatives, that will be very well appreciated.